Hello, Dr. Jenn, and welcome. I am so excited to speak to you. I've been really looking forward to this because
Oh,
you
me too.
are you are a wealth of knowledge. You are one smart cookie, and you've been speaking to a lot of my mentors. I see you out there doing Instagram lives and podcasts. So I'm so excited. And we're going to clear up a lot of misconceptions, I think, or some fears. So let's dive in. And why don't we start with you telling the listeners a bit about your background and your tale, because you have a little bit of a heartbreaking tale that got you started into this world. So why don't we start
Yeah,
there?
yeah, absolutely. I mean, it's not, first of all, thank you so much for having me.
Yeah,
And
of
it's such a pleasure to be here. And we definitely have a mutual admiration thing going. So I'm
course.
really, really delighted to be here. I don't think that my story is that unusual in that a lot of us who come to really own a space come to it because we've had great pain in
Mhm,
that space.
mhm,
And I'm no exception. So, I didn't become a breast cancer doctor by accident. Breast cancer, actually, I don't remember a time in my life where I didn't know about breast cancer. It's been part of the thread, the
mhm,
fabric of my family for as long as I can remember. When I was a child growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was
mhm.
the queen of Motown sound in Philadelphia. She was beautiful. She was brilliant, larger than life, lit up a room when she walked in. And she was my hero. She actually wrote 54 hits. Can you imagine 54 hits?
Amazing.
And her most famous song was The Greatest Love of All.
Famous,
And
famous song.
yes, yes,
Hmm.
like really, truly, there wasn't a person alive that didn't know that song.
Yeah, yeah.
And she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world.
Hmm.
And at that time, it would spend 14 weeks at the top of the charts. Only Linda would never know because she died of metastatic breast cancer just 1 month after Whitney released that song. I was 16 years old when my hero died.
Yeah.
I still can't tell the story without bringing tears to my eyes.
I'm so sorry.
And her life and ultimately her death gave birth to my life's purpose because I never wanted another woman, another family, another community to have to suffer the way that ours suffered.
Yeah.
And so I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. And I did that really well and for a really long time. And at what was arguably the height of my career, when I was running the surgical program for my hospital and running the cancer program for my hospital, and I was a wife and a mother and a stepmother and an athlete and a philanthropist, and I have all these balls in the air and consider myself an expert juggler. And in what seemed like a day, went from being one of the most high functioning people you've ever met to I couldn't walk across the room because I didn't have the breath in my body to do it. And I underwent this really intense 3-day workup because, when your star pony is sick, you make sure that you're going to get them better. And so I found myself sitting in the office of my friend and colleague and physician, and he tells me that I need surgery and chemoradiation and all of these things that I say all day long without hesitation or reservation. But I'll tell you what, when those words are coming at you, they
Mm.
have different meaning. And I don't know to this day what to call it. You can call it God, you can call it universe, you can call it inner voice, but something told me there's more. Go find it. I refused treatment. My friend told me the same thing that I had told thousands of women before that you will die of your disease. And it's not that I didn't believe him or know that it was standard of care. I mean, I'm a cancer doctor running a cancer program. Like I know it's standard of care. And yet that voice told me there's something more, go find it. And so I went on a journey, a selfish journey to heal myself that very shortly allowed me to see what the reason was. And so I was very fortunate that in very short order, I came to be in a room and I'm listening to a series of lectures, and a man walks on stage and he introduces himself as a functional medicine physician. Now, at this point, I had been a doctor for about 20 years. And though I was very sick, I was still my cynical, conventional medical self. And all I could think of is, there's no such thing as functional medicine. What is this quack talking about? And then I remembered why I was there. And I checked my ego at the door. And I tuned into what this man had to say. And it changed my world. In that day, in that moment, in that instant, changed my world. Now, the man was Mark Hyman. And though I feel like everyone knows who he is now, and he's like a superstar, you know, this was 2016, 2017.
Yeah.
I didn't know who he was. There were lots of people who didn't know who he was. So, and what he was talking about was root cause illness. Something that in all my years of medical school training, and I went to one of the top medical schools in the United States, in my years of surgical residency, in my years of fellowship, we never talked about root cause medicine. Never. We were trained, and this is what a good doctor is in the conventional medical space, right? You're really astute because you memorized a lot of things. And you're able to recognize and recall those symptoms, put them together, give it a name, and prescribe. That's a good doctor in the conventional medical system. That's a rock star in the conventional medical system. And yet, we are not helping people, especially not people with chronic disease, because naming the baby and giving it a dress does not help. It does not help. And essentially what I was doing, even as a surgeon, was I was just taking people from one space to the next. I was delaying the inevitable for them, but I was not doing anything to affect the trajectory of their lives. So when Dr. Hyman was up there speaking about root cause illness, getting to the why, eliminating inflammation, you can change people's lives. You can eliminate suffering. And after all, isn't that why we all went into this space? That's what we wanted to do. No one went to medical school because they wanted to prescribe the latest pill. No one ever did that. We all did that because we wanted to learn to heal people. Only that's not what the conventional medical world is about. And please know that I am not in any way trying to diminish what conventional medical doctors do. They are doing their job. And a lot of it they're doing their job well. They're doing exactly what they were trained to do, exactly how they were trained to do it. And unless you have opportunities like the one that I had, you continue to walk around with those blinders. So, you know, is cancer a blessing? No, of course it's not a blessing, but it is an opportunity. And it's an opportunity for some people for something really great. And
Yeah.
I would have never been here without being sick.
Mm.
Now, I do not want to paint any rosy pictures. I
Yeah.
got a lot worse before I got better.
Mm.
It took me years to heal.
Yeah.
And it took a huge toll on me physically. It took a toll on my family. It took a toll on me professionally,
Mm.
all of that.
Mm-hmm.
However, I came out on the other side a better person, a better wife, a
Mm-hmm.
better mother, a way better physician, a better human being. I
Mm-hmm.
came out with curiosity.
Mm-hmm.
And that's what we all need to have. We need to have curiosity. We need to always be open to the fact that we can do it better, live it better, want it better, love it better, all of it,
Mm-hmm.
all of it.
Wow. Thank you. That was amazing. And yeah, quite a touching story. And I though think there are some people like you, I'm proud when I hear that somebody has gone through a struggle, but was determined to turn that struggle into something so much greater. Because there are two paths we can take. We can go through struggle and trauma in life and fall victim to it. Or we can go, okay, this is an opportunity, like you said, to get curious, to level up, to ask questions. And that's what you did. And because of that, you are touching so many more people in the world and helping so many more people. So
That's
I love that
exactly
so
right.
much. All right, so let's get into the nuts and bolts of breast cancer, breast health. My mum actually had breast cancer. She had breast and ovarian cancer. And we don't have the BRCA gene, but this is definitely something that's touched my family and it's near and dear to me. So let's dive in to breast cancer. And I want to start with this question. Does estrogen cause breast cancer?
I don't mean to laugh.
No, but
I'm
I know why you are.
sorry.
I know why you are.
Right. So listen, we unfortunately are trained to think along algorithms. I mean, no more is that more obvious than right now in this time and space, right? Before, the algorithms were happening without us knowing. Now we're all kind of clued into the fact that, you're talking about something and you open up your computer and all of a sudden it's there. Like
Yeah.
we know that it's following us. But
Mhm.
before we knew about it, we were all kind of in this space that like, let's create a solution and then we'll tell people this is the problem. And this is where
Mm.
that whole estrogen thing came from,
Yeah. Mhm.
right? So I want to say without a shadow of a doubt that estrogen does not cause breast cancer.
Mhm.
And if you don't believe me, then you have to think that women were put on this earth for the purposes of getting breast cancer.
Yeah.
Because estrogen, as it turns out, is the hormone of life.
Yeah.
And without estrogen, we literally die. And
Mhm.
we see that in every postmenopausal woman,
Mhm.
that as the estrogen starts to go away, what do we lose? We lose our brain function, we lose our cognitive function, we lose our capacity to think, reason, compute. You see these women with word search issues,
Yeah.
that's a lack of estrogen in the brain, right? When you can't think of that word. People were, I say this all the time. I was a cashier in high school at Murray's Deli. That was my job in high school. And I could make change on a dime all the time. I was really good at math. Unlike Barbie, I was really good at math. Okay.
Mhm.
When I went through menopause,
Yeah.
and because I came out of training in 2003.
Right.
So in 2003 was when the Women's Health Initiative hit the world.
Mhm.
And everyone believed
Yeah.
that hormones caused breast cancer.
Mhm.
And there was nowhere that it was more pounded into the brain than in the breast cancer space.
Yeah.
So my mentor, the man that taught me, he was really the first dedicated breast surgeon in Philadelphia. He was a world-renowned surgeon. He had an international think tank where all the top people in the breast cancer field would get together twice a year and kind of do position papers and all that. So in 2003, Dr. Gordon Schwartz of blessed memory taught me three things. He taught me that hormones cause breast cancer, and the only people that should take hormone replacement are the people that absolutely, positively cannot live without it. And if you put someone on hormone replacement, it should be the smallest dose for the shortest period of time, which I'm sure you heard that, right? Because in 2003, that's what the world heard. And we went from millions and millions and millions of women on hormone replacement to overnight, 70, 80% of them stopped.
Terrible. Yeah.
90% of the prescribers stopped.
Terrible.
And decades of women suffered as a result.
Yeah.
So when estrogen stops, we literally start to die, literally.
Yes.
So all those cognitive changes, they happen. And, you know, I went from someone who was really good at math to like, I couldn't solve simple arithmetic in my head anymore. And that is actually what led me to learning about hormones and to questioning whether or not estrogen causes breast cancer. So I have done a deep dive in this space. So as we think about it, if estrogen caused breast cancer, now there have been, let's see, without getting this show canceled, how can I talk about it? There was something that affected the whole world a couple of years ago that has had a greater impact on who develops cancer and how old they are when they develop cancer. Let's leave it at that.
Sure.
Okay. But before then, we really saw the vast majority of cancers in the postmenopausal population.
Yes.
Now, I know that everyone doesn't go around measuring estrogen levels in people, but I'm very accustomed to seeing labs and estrogen levels in premenopausal women, perimenopausal women, postmenopausal women. Let me tell you about estrogen levels in postmenopausal women. They're hard to find.
Yeah.
They're hard to find. They're low, 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 low. And when you get into the 70s, they're like barely measurable. But guess what? Breast cancer is far more common in them. Right? So we see a direct correlation that as estrogen levels drop, breast cancer incidence increases. So if estrogen is the problem,
make it make sense.
Why does breast cancer become more prevalent when estrogen is gone? And not for nothing, but when we see the highest levels of estrogen in life, teenagers, women in their early 20s, like we'll peak in estrogen levels, late 20s, maybe early 30s for some people. And then it's downhill from there. And pregnant women have 10 times the amount of estrogen that non-pregnant women get. But this isn't the population that we're seeing breast cancer in. We're seeing breast cancer in the estrogen depleted population. There is no way that estrogen causes breast cancer. However, it has become a very convenient explanation, right? And that story is told, that narrative is out there for the purposes of selling drugs. So think about, what do we give to women with hormone positive breast cancer? And let's not confuse hormone positive breast cancer with causation. Hormone positive breast cancer means that you have estrogen and progesterone receptors or progesterone receptors on the surface of your tumor cells. You know what normal breast cells have on their receptors?
Mm.
Estrogen and progesterone on their surface, estrogen and progesterone receptors.
Yeah,
It's normal.
it's normal.
It's a variation of normal. And
Yeah.
it's actually the tumors that no longer have those receptors on them. Those are
Mhm.
the tumors we need to worry about.
Yeah.
Those are the tumors that have gone rogue.
Yeah.
Those are the cells that are no longer kind of following the rules.
Hmm.
They're not listening to the rules anymore. They're not being governed by estrogen and progesterone,
Which
because
is
estrogen's
normal.
the on button and progesterone's the off button.
So it's normal for the listeners. It's normal to have these receptors on the breast cell. So you want
Yes.
that normal breast cell receptor that says your breast cells, correct me if I'm wrong, obviously, I might be butchering all this, but your breast cells are functioning in a more normal way than if they
Yes.
didn't have the
Yes.
receptors.
Now, all cancer cells are a mutated cell,
Uh-huh.
right? But if you have a cell that no longer has hormone receptors on it, that is a far mutation from normal. That's
Yeah.
a far departure from normal. And these are the cancers that are more difficult to treat.
And so
Not
many people,
impossible.
all in the community, so many people, the amount of questions and comments I get, what if I've had estrogen positive or progesterone positive breast cancer, and they don't understand. They actually think that's a negative when it's more of a positive. And then we have women taking DIM. I actually had a lady just today message me saying I had estrogen positive breast cancer. I'm on DIM. Should I not be on DIM? So we have this thought that we should be lowering estrogen. And I'm sure we'll get to it, but tamoxifen, right? I'd love your thoughts on tamoxifen.
So here's the crazy part about tamoxifen. People are like, oh no, I can't take estrogen because I have hormone positive breast cancer
Yeah.
or had hormone positive breast
Yeah.
cancer. And like the big dirty secret is, guess what, guys? Tamoxifen is estrogen.
Yeah.
It's a synthetic estrogen. That's
Mm.
why it sits on the estrogen receptor, right?
Mm.
People think it's an anti-estrogen drug. It's
Yes.
not. It's not. It's a synthetic estrogen, which has some protective effects
Mm.
in the breast, yes, but not in the uterus.
Yeah, right.
And in the uterus, it's stimulatory, which is why we see an increase in uterine cancer in women who take tamoxifen,
Wow. Mm.
along with some other fairly unwanted side effects.
Hmm.
So I think that there are so many things in the breast cancer space that if we actually called them what they were and
Mm.
informed people, they would make very different decisions.
Yeah.
Like people would never take estrogen because they're so conditioned to think that estrogen is bad, but yet they don't even realize that tamoxifen is a form of estrogen,
No.
a synthetic, mutated form
Yeah.
of estrogen,
Yeah. And
right?
and we know that estrogen actually protects the breasts, right? So women
That's
who are
correct.
taking estrogen at the time of diagnosis of a breast cancer are actually more likely to survive or have better outcomes than a woman not taking estrogen.
That's correct.
Right?
And it's interesting that that information that also came out of the Women's Health
Yes.
Initiative study, that information was never publicized. The fact that women who took hormone replacement
Mm.
and got breast cancer had better outcomes than women
Yeah.
who didn't.
Criminal.
It is criminal. It
Mhm.
is criminal because decades of women have suffered unnecessarily and they continue to suffer.
Yeah, oh,
Now we
absolutely.
we are better as a society of prescribing hormone replacement for people. So
Mhm.
I do believe that that is changing.
Yeah.
It's becoming more common, it's becoming more liberal. Do I
Yeah.
wish that more people were doing it better and more responsibly? Yeah, I do.
Mhm.
I do. I think that there are some people who still are not doing it well, but at least we're having the conversations. But you
Mhm.
know who's left out of that conversation? The
Mhm.
people with breast cancer.
Oh yeah. Oh yeah. Well,
The
my
people
own
with a
mother.
history of breast cancer are
Absolutely.
left out of that conversation, and they're the people that need it the most.
Absolutely. And it's not just estrogen as well. It's also progesterone, which obviously has different roles in the body. But my own mother went to her doctor because she's, having symptoms. And I said, you've really got to look into these hormones, right? Because I knew that progesterone, at least to start, would be a game changer for her. In a huge way, like
Mhm.
progesterone, the mental health benefits,
Yes.
the sleep benefits. But her
Yes.
doctor told her that there will be more harm than good if she goes on progesterone because that doctor's obviously operating from old flawed data. And we know progestins and progesterone are different. But listen, she started to take some topical progesterone and already game changer.
Yeah.
It is really criminal and it's
Yeah.
really causing a lot of women to suffer. It makes me so angry.
So I think the major problem is that with the Women's Health Initiative and the complete drop off in prescribing, so too did the education go away.
Yeah, for
And
sure.
there are practitioners out there who don't even know how to recognize the
Yes.
symptoms.
Yeah.
And I this is a really big area that needs a lot of attention
Mhm.
because think about the women who, when progesterone goes away, because progesterone, you have to think about it as it's our calming hormone.
Yeah.
It's the off button. It's the thing that allows for rest and repair and restoration and all of that. So one of the symptoms of menopause is palpitations.
Yeah.
And because, that's part of like the overexcitement that needs to be calmed.
Mm-hmm.
So what happens when these women who are perimenopausal get palpitations? They
Mm-hmm.
get these huge cardiac workups,
Yes.
huge cardiac workups,
Yes. Oh, all the time.
instead
Yeah.
of just getting progesterone, which
Progesterone.
is what they need.
Yes. Yeah.
And this goes across the board. They get dizziness, lightheadedness. Well,
Yeah.
this is fairly common
Yeah.
with menopause,
Mm-hmm.
and yet it's not recognized. And so they get neurological workups,
Yeah. Yeah.
and
Absolutely.
on and on and on it goes.
Yeah. Yeah.
And and so we really need to train physicians in recognizing what
Mm.
perimenopausal symptoms are. Sorry, I'm going to pick my dog up because he's barking. I
That's okay.
apologize.
All right, let's chat. I really want to get into imaging because that's a big one that I know you speak out a lot about mammograms. And so I want you to educate me and educate the listeners on imaging.
Yeah.
There's a mentor of mine, he's really pro mammograms, but then I have other mentors who are not. And so let's talk about that. I think that's really
Yeah.
important.
So, I want to start off by saying that when the mammographic screening program came into being in the 1970s, it really did come into being with the greatest of intents,
Yeah.
right? So it's built on this foundational belief that breast cancer growth is both linear and predictable.
Uh-huh.
And so breast cancers start small,
Mhm.
grow to some critical size, at which point they are more likely to metastasize. And if you identify a breast cancer before it reached that critical mass, that you could save lives and save breasts.
Mhm.
It's a lovely theory.
Yeah.
Just doesn't happen to be true.
Mm.
And we've known that theory is not true for 50 years. So we started to screen women because mammograms save lives.
Mm.
And when we started to screen women, we screened women with a 2D mammogram. And no matter how many mammograms we do every year, the same exact number of women die
Mhm.
of breast cancer.
Yeah, right.
No matter how many mammograms we do every year, the same exact number of women present with benign disease, with advanced disease.
Yeah.
And this is the reason. Breast cancers are what they are from the beginning. And finding something before some critical mass is meaningless. If it's an aggressive cancer, it's an aggressive cancer, and it's going to behave aggressively. And if it's not an aggressive cancer, it's not. And so where you find it won't matter. And that's why we have the exact same number of women die every single year of breast cancer. Now, what changes is the number of women every year that we treat for breast cancer. But we're treating a lot of breast cancer that doesn't need to be treated.
Yeah.
And that's the problem.
Yeah.
And it's made worse by the fact that our treatments for breast cancer, they're not benign. Not benign. So you take a woman and you treat her for breast cancer, and you are shortening the longevity, and you are diminishing the quality of her life. Because almost all of the treatments for breast cancer, surgery included, those scars run deep. There is significant toxicity associated. Significant. And we're talking about affecting heart health and 2 to 3 times increase in cardiovascular death in women who have been treated for breast cancer as opposed to those who haven't. Increases in dementia, increases in osteoporosis, unless we forget that the exact same number of women die every year of a complication of a fracture as do of breast cancer. We cannot afford to diminish these women's bone health. Bone health is important. Fractures are deadly.
Oh, absolutely. Yeah.
And so, you know, the mammographic screening program started at like when you look at incidence of breast cancer and you look from 1999, I know it started in the 1970s, but let's talk about modern screening techniques. So when you look from 1999 to about 2012, the breast cancer incidence is rising like this, okay? In 2012, we start to see the curve go like this. Now, what happened in 2012 is we went from 2D mammogram to 3D mammogram to digital breast tomosynthesis, and we're delivering 2 to 3 times the amount of radiation. And we're seeing the breast cancers go up as a result. And we're not saving lives. So let's address the other part of it. Are we saving breasts? Are we, in fact, using this screening method, which, yes, it does use radiation, but it's justified because, you know, we may not be saving lives, but we're saving breasts. And then we look at the numbers and we're not saving breasts. Because what happens is women are so filled with fear when they get that breast diagnosis that they don't even hear what the doctor is saying or what the doctor should be saying, which is that the outcome is exactly the same if you do a lumpectomy or do a mastectomy. They can't hear that. They don't hear that. They're just filled with fear. Filled with fear.
So what's the answer then, if not mammograms?
So listen, I obviously have looked deeply into mammograms. I don't believe in radiating the general population. I don't believe in taking healthy women, because that is the screening population, right? I don't believe in taking healthy women and subjecting them to radiation and increasing the risk of breast cancer, because that's what's happening. I mean, we are causing a number of breast cancers every year just from performing mammograms on people. And we know from the Swedish data that if you take the population of women that screen and the women that don't, and they have equal access to care and quality of care, there is no survival difference between them. So mammogram is not saving lives. The only difference is we're treating more breast cancers. So I am not a fan of mammogram. I think there is absolutely no justification for mammograms. But women want to do something. They don't feel comfortable with the watch and wait.
Yeah.
right? They think of it as preventative. It's,
Mm.
of course, not preventative, but people want something active. They want to do something.
Yeah.
So this is what I say.
Mm-hmm.
I think that everyone should be doing self-examination.
Mm-hmm.
I think that no one is going to know you better than you know yourself.
Yeah.
No one is going to know your body better than you know yourself.
Mm-hmm.
And not that you need to be your own doctor, but I do think that we all need to own our health
Oh, 100%.
because
Yeah.
we understand who we are and what we feel
Mhm.
like.
Yeah.
And no doctor, no matter how good a relationship you have with that doctor or how long you've been seeing that doctor, they're never going to know you better than you know yourself.
No.
So I believe heavily in self-breast examination.
Mhm.
Now, if you want to do imaging, for many years, people were talking about thermography, and thermography got a bad rap. And the
Mhm.
reason that thermography got a bad rap is because people used it as a screening tool for breast cancer.
Yeah.
And that's not what it is.
Mhm.
Thermography recognizes a heat signal. It
Mhm.
detects inflammation.
Yeah.
Inflammation, as it turns out, is the root cause
Mhm.
of most of our chronic disease.
Mhm.
So it's very important to know if you have inflammation. And I use thermography to look for sources of inflammation. However, not all breast cancers are going to cause an inflammatory response.
Right.
Some of them are very slow growing and they're
Mhm.
not going to be detected that way. Now, I can argue that those are also probably the breast cancers that don't need treatment, but that's a talk for another time.
Mhm.
So, thermography is a great test to find inflammation, but then it needs to be paired with something else if you're going to use it as a breast cancer detection tool, like an ultrasound. Now,
Mhm.
ultrasounds are not the most sensitive thing, but they're fine. They're
Okay.
fine. They're good enough
Mm.
because the cancers that you need to find are going to be found that way.
Okay. Mm.
And all of this was what is the answer that I would have given you
Mm.
pre-2024.
Mhm.
Now, in 2024, we are very fortunate that the FDA cleared the first screening device in 50 years to screen for breast cancer. It's called QT imaging.
Mm.
And this is a test that uses sound waves transmitted through a water bath that will have 40 times the resolution of MRI. So
Wow.
without radiation, without pain, and without compression, you can get a true 3D reconstruction of the breast.
Mm.
It is not universally available yet.
Mm.
I
Do you
have
know
no
if it's in
idea.
Australia?
I have no idea when it's coming to Australia, but it's not there yet.
Yeah.
It is only now getting some distribution within the United States.
Okay.
That said, in 5 years, this is going to be the go-to test for breast screening.
Right.
And until then, we
Mhm.
just need to be proactive about our health because that is really the most important thing. The best way to prevent breast cancer
Yeah.
is to do all the things that we know that drive health.
And so let's
And
talk about them.
yeah, because at the end of the day, what I say is breast health is health.
I love it.
And
Love
the same things that are going to give you healthy breasts are going to give you a healthy brain,
it.
going to
Mm.
give you a healthy heart, a healthy gut, healthy skin, healthy bones, healthy joints, healthy
Mhm.
vagina, healthy bladder, healthy uterus,
Yes.
all the things,
Yes.
right? So the same way breast health is health, fertility is health, like
Mhm.
this is
Mhm.
all, we're all pointing to the same things.
Yes.
And in order to achieve that, you're going to eat in a way that's nourishing for you. There is no one diet,
Yeah.
and there's no one diet for one person, in that I think that there's a season for everything, and
Yeah.
that there are going to be times in your life where something works for you, and
Mm.
times in your life where that doesn't work for you, and you're going to have to make a shift.
Yeah.
And this is all a journey, it's not a destination. And we
Mhm.
are constantly curious and constantly fluid and constantly learning.
Yes.
And, I can tell you that what worked for me in my 20s didn't work for me in my 30s, didn't work for me in my 40s, doesn't work for me in my 50s.
Yeah.
I'm constantly learning, constantly changing because that's what we need.
Yeah.
But I think that all of us can agree, it doesn't matter if you're keto, if you're carnivore, if you're vegan, if you're whatever you are, we can all agree processed food is bad.
Exactly.
Processed food is not good for you. And
Mm-hmm.
so, in as much as you can, you should be eating things in their original form that
Mm-hmm.
have one ingredient that comes somehow from nature,
Yes.
right? Like if a 3-year-old can tell you absolutely everything that's in that,
Yeah.
it's probably okay,
Yeah.
right? Like
Mm-hmm.
carrot,
Yeah.
right? So that's probably okay. And
Yeah.
if a 3-year-old can't tell you what's in that, it's
Mm-hmm.
probably not something that should be a regular part of your diet.
Mm-hmm.
Now, don't shoot the messenger. I'm not saying you're never going to have a piece of birthday cake again, but I'm saying like you have one birthday a year. You're not celebrating everyone's birthday,
Exactly.
right?
Mm.
The other thing I always feel obligated to talk about is alcohol.
Mm.
And like, please don't shoot the messenger. But that, the American Cancer Society says that there is no safe amount of
Yeah.
alcohol for women. And as much as I hate to admit it,
Mm-hmm.
men and women are not equal.
No.
And we do not process alcohol the same way that men do.
Mm-hmm.
We do not have the capacity for alcohol in the same way that men do. And so while men can maybe have an alcoholic beverage every day, one,
Mm-hmm.
women cannot.
Mm-mm.
We simply do not have the capacity to do that. And what happens is that if we expose ourselves to alcohol on a regular basis, we are not going to be able to metabolize it.
Yeah.
And that is going to affect us at the expense of something else that we were supposed to get rid of, something else that we were supposed to detoxify.
Mm-hmm.
And after all, breast cancer is just you having met your toxic load.
Yeah.
Your body cannot do it anymore. And
Mm.
it has caused an environmental shift.
Yeah.
And what cancer is your body saying, I I feel threatened. I'm
Mm-hmm.
a cell that feels threatened. I'm transforming myself. I'm going into survival mode. And that's what's happening.
Constipation has actually been linked to breast cancer, hasn't it?
100%,
Yeah.
because what's happening is that instead
Circulation.
of passing those toxins out of your body, if it's
Circulating.
sitting in your body, you're going to reabsorb it into
Mm-hmm.
the enterohepatic circulation. It's
Mm-hmm.
coming back into your liver. So
Mm-hmm.
you're increasing the toxic burden of your liver, which your liver is already in charge of clearing out all the toxins.
Yeah. And
It's
by that
already doing that.
and that same mechanism, we've got that estrobolome, right, in the gut. And so if we
Yes,
don't have a healthy gut, same thing, out it goes into the bloodstream, into the
that's
liver.
right.
So
That's right. But it's not estrogen that's
yeah,
going out into the bloodstream. It is the breakdown products of
yes.
estrogen,
Mm-hmm.
and those damage DNA.
Yeah,
And that is part of the problem.
yeah, yeah.
And so, as we have like oversimplified the estrogen story,
Mm,
this is where that estrogen causes breast cancer comes
yeah,
in.
yeah. Mm-hmm, mm-hmm. Absolutely.
Yeah.
All right. So healthy diet, making
Healthy
sure
diet.
gut
You
health,
need
lower
you
toxin,
need to move your body.
move your
You
body.
need to move your body.
Yeah,
So at different stages in your life, that movement is going to look differently.
yeah.
In your 20s and 30s, you can be cardio heavy and,
Mm-hmm.
do your movement that way.
Yeah.
As you enter into your 40s,
Mm-hmm.
50s, beyond, you have to lift heavy things. You
Yeah.
have to maintain that muscle mass.
Yeah.
That is the key to your metabolism,
Yeah.
and you have to maintain that muscle mass.
Mm-hmm.
So even if it, again, it's this whole concept of even if it worked for you then, it's
Mm,
not going to work for you now.
mm-mm.
And you need to maintain fluidity with that.
Yeah.
And in addition to lifting heavy things, you have to keep up your balance and you have to keep up your flexibility, because that's what connects your brain and your body.
Mm-hmm.
And so movement, really important. Mindset, managing stress.
Yeah.
We're never going to get rid of the stressors. Never, ever, ever, ever. However, we can control what impact they have on us.
Yeah.
We can decide what we're going to internalize, what we're going to allow to affect us.
Mm-hmm.
But you have to build the skill set to do it. You have to build your toolbox to do it.
Yes.
And in order to do that, you got to work. It's a
Yeah.
practice,
It is
like
a
anything
practice.
else.
Absolutely.
Practice.
Oh
And
my.
then, of course, it's toxin avoidance, it's detoxification, it is prioritizing sleep. Sleep is where the healing happens.
Yeah.
If you're not sleeping, you're not healing. And we start to lose our ability to sleep as we age,
Yes.
somewhat because of that progesterone relationship that we talked about.
Yeah.
And so, again, that's where hormonal health comes into play. I don't believe in hormonal balance after menopause. I think that the only way that you achieve that is when you do hormone replenishment.
Yes. Absolutely.
And then at the end of the day, you have to live a connected, purpose-driven life,
Yeah.
because this life is all about, we're social beings.
Mm-hmm.
It's all about connection. It's all about what our effect and impact that we're having on the rest of the world is. And everyone has a purpose. God put every single one of us here with a purpose, and no one's purpose is more important.
Yeah.
So, the fact that I reach millions of people, the fact that you reach millions of people, that's wonderful, but that's our purpose. But it's no more important than the person who is volunteering and serving food to people in need. It's no different than the housewife or the mother of a special needs child whose life is consumed at
Yeah.
making that person's life better.
Absolutely.
We need everyone,
Yeah.
and everyone's purpose is important. And all you have to do is live yours. I'm never going to be the best version of you, and you're never going to be the best version of me. And we're not meant to be.
Yeah.
We're meant to be the best version of ourselves and fulfill our own individual purpose.
Oh, I love it. Thank you. I
My
think there's
pleasure.
no better part of this conversation to wrap things up than on that beautiful note. So, why don't you tell everybody where they can find you?
Yeah. So you can follow me on all the social media channels and outlets. I'm Dr. Jenn Simmons, and my Jen has two N's. If you like what you heard, I have a podcast too, and it's called Keeping Abreast with Dr. Jenn. We put a new episode out every week, and I hope to have you as a guest on mine. That would be so wonderful. Um, my website is called Real Health MD, and that's where all of our programming exists, and you can learn about that. I did write a book. It's called The Smart Woman's Guide to Breast Cancer. It's available on Amazon. It's a bestseller in your country and mine, fortunately. So that's really exciting and was a labor of love, and that was written for anyone who is affected by a breast cancer diagnosis in any way, because I don't want people to have to wait for the information. But even if you have already had a diagnosis, this can really guide you to not only reclaiming your health, but achieving the health that you want. And, most of the people that I work with, they have far better health after their diagnosis than they ever had before.
Absolutely. Well,
And so pick up that book from Amazon.
yeah, and we will link to everything in the show notes to make it nice and easy for everybody.
Amazing.
Thank you. It's been
So
such an honor.
I was so happy to be here. So happy to be here. Thank you for having me.
Thank you. Bye for now. I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.